So next we are going to see about normal PO2 in the hypothetical perfect lung. There is normal lung also, there is a lot of heterogeneity in the VQ ventilation perfusion ratio. You won't see the perfect lung. So for the example teaching purpose, I am drawing it as a hypothetical perfect lung. When you the patient taking spontaneous breath from the room air. So if example that is the alveolar, when the inspired gas PO2 used to be 150. When it reaches the alveoli, its PO2 used to be 100. When it's further it goes to the tissues, the PO2 used to be around 30 to 40. So that is the serially the PO2 is increasing. Partial pressure of oxygen from the inspired gas is 150 and the alveoli level it is 100 and tissue level is lesser than the 100. It is a normal thing. So whenever the patients, there is a, already we discussed about that, there is a two cause respiratory failure is identified by the hypoxia and hypercapnia. First we will go with the hypoxia. There is a four most common causes of hypoxia. One is the diffusion limitation, second one is the hypoventilation, third one is a decreased inspired oxygen, partial pressure of inspired oxygen, fourth one is the shunt. So first we will start with the hypoventilation. Here in the first way, this is the normal lung. Normal lung means there is no problem with the perfusion, there is lung structures are normal. Patient taking a breath, inspiratory breath, it goes to the alveoli and the gas is exchanging between the alveoli and the blood vessels. So it is a normal. When I taking the patient's breath, patient taking normally it's a minute ventilation, example it's a 5 liter. Patient only taking 3 liter or 2.5 liter, this means 50% drop in the patient's minute ventilation. So we will call it as a hypoventilation. So what will happen if the patient is in the hypoventilation? Okay. So the patient taking inspired gas from the room air, the PO2 of the alveolar airway gases used to be 150, which is normal. Okay. When this inspired gas reaches the alveoli level, the PO2 is dropped. Partial pressure of oxygen is dropped. It's now around, it's less than 100. Normally it should be 100. In the hyperventilation, it is less than 100. So if it is less than 100, the tissue level also, that is PO2 going to be low. So the hypoventilation will cause hypoxia and also it's cause hypercapnia also. This is a formula, that is a alveolar ventilation. VA is alveolar ventilation, that is the VCO2 is a carbon dioxide production in the body, K is a constant, the PCO2 is the partial pressure of carbon dioxide. Okay. So when you see here the VCO2, there is a carbon dioxide production in your body, it is going to be a constant. Not otherwise patient is on any change in the patient condition, otherwise the VCO2 going to be constant, K is already constant. So the PCO2 is mainly depends upon your alveolar ventilation. If any change in alveolar ventilation, it is represented by the change in your PCO2. If example patient taking 5 liter of minute ventilation, at that time my PCO2 was 40. Okay. If my patient is minute ventilation is now decreased to, if example at least increased to 10 liter, my PCO2 going to be 20, because that it is the alveolar ventilation determine your PCO2. If my minute ventilation decreased to 2.5, my PCO2 goes to 80. So the 50% drop in the minute ventilation going to double the PCO2 level. So the PCO2 is mainly depends upon alveolar ventilation. In the hypoventilation, what happening here, my alveolar ventilation going to decrease, so PCO2 will rise. Okay. So the alveolar ventilation is decreased, so PCO2 is rising. So the any hypoventilation patient is presented as a both hypoxia and hypercapnia. Any hypoventilated patient present as a both hypercapnia and hypoxia. Why that hypercapnia, we are understanding this formula. Why the hypoxia occurring with the alveolar hypoventilation? For that you need to understand the alveolar gas equation. This is the partial pressure of alveolar oxygen depends upon this is FiO2. This is the inspired oxygen. For example, room air, it is 21%. This is a partial pressure of atmospheric, partial pressure of the inspired gas. Atmospheric pressure is 760. This is the humidity level of the inspired gas. It's around 47. This is the alveolar PCO2. This R is a respiratory, it's a constant. Most of the time it will be a constant. Okay. If example the 21, this is 760 minus 47, it will comes around 713 into 0.21, you multiply, it will comes around 150. Okay. Normally, the alveolar PCO2 used to be 40 divided by 0.8. The PaO2 alveolar partial pressure of oxygen is 100. This is in the normal lung, normally ventilating time. What will happen if the patient is going for hypoventilation? If my patient is going for hypoventilation, what will happen? My inspired oxygen going partial pressure of inspired oxygen percent fraction of inspired oxygen going to be 21% same. Otherwise if supplementing oxygen, the atmospheric pressure also 760, my humidity also nothing going to change. So the inspired partial pressure of oxygen in the air is 150. Because of that, my ventilation is 50% decreased. More PCO2, alveolar PCO2 will be double. Previously it was 40, now 80. So it's 80 by 0.8, it's 100. So 100, so 150 minus 100, my alveolar oxygen is now 50. That's why I am saying that if any patient going for hypoventilation, it will cause hypoxia because of the alveolar CO2 is increasing because of the decreased alveolar ventilation. Both the alveolar carbon dioxide also depends upon alveolar. So any alveolar ventilation, any hypoventilation, it will cause increase in PCO2, decrease in PO2. It's cause both hypoxia and hypercapnia.